taskmaster to have a chat with us. It's Dr. Onn Ben David. Onn has an Order of Australia. He was elected as the Vice Chair of the RSPCA and has been for many, many years. I'll tell you now how many years. Since 1980, 2008, I think he's held positions with them. He's one of the most respected members of the RSPCA. They call on him. He sits on all the panels with the governments and all. And he ensures, and he's here to ensure that the dogs that we utilize are looked after. We walked into a demonstration just yesterday in Yeri, we'll attest to it, and the person said, "But you haven't bought a dog." We looked at him like he was crazy, and he said, "But how can we bring a dog when we haven't seen where the dog's going to go into?" You know, this is the training that we get from Onn. This is the protocols that we get. And we never take dogs into an unsafe environment. If the person or the child we're talking to is unsafe, we have protocols led by Onn and given to us by Onn. And he checks up on us very regularly, so please.
Thank you. Number one. Number one, I wanted to actually very strongly support what Linda said, scientific-wise. From a veterinary point of view, from a practical point of view, the role of dogs in the society, in individual homes, on individual level with people, in the community as a whole, is really second to none, and it's actually at the start of a much bigger revolution. Because finally, lawmakers in this country and people who set standards and codes of practice recognize the role of dogs, and they will be now helping us to develop a much bigger role and a much valuable relationship between dogs, and for this matter cats too, but we are talking dogs today, and people generally. And a lot of the things that Linda identified, the research that she's identified, I see in my practice day to day how it actually works. I see it in patients with heart disease and things like this, and nowadays I've actually prescribed a dog to walk with, rather than just sit at home and get medication, because it makes life easier. And I don't want to go more about it. I think Linda covered it in its scientific fashion exceptionally well. So that's taken, as far as I'm concerned, as a standard level. I think dogs, or maybe before I go to that, just to say my role is mainly from the dog's point of view. So though I'm saying some things that relate to treatment, which is not my expertise, but I think I'm looking from the dog's point of view and see how the dogs value it, how the dogs appreciate it. And I will talk some issues that probably all of you know, because I saw that most of you picked up your hands and saying you have dogs at home. I'm not going to ask how many vets are here. Don't ask. But because if you have dogs, some of the issues I'll say may not be as relevant, but I think it's important if we were thinking of a dog in the way we want to have the dog, meaning this dog is going to be more than part of the family. Spot for Kevin and his family is more than just a child. It is an absolute, the center. And so if we do think of this way, then we do have responsibilities to that dog, and there are things we need to be cognizant of. That's the sort of thing I will want to talk about, and in a quick talk that I'll give now. Dogs in autistic person life are well suited to bond with an autistic person and assist and support this person, and I think Kevin's presentation was an excellent, practical, off the cuff, from his heart explanation of how effective it is. Dogs are best friends, are men best friends, and there's nothing more obvious than its relationship with autistic people, or for this matter, Alzheimer's and other situations like this. Service dogs absolutely perform a vital function. They are more suited to be trained and used in that way. And Linda mentioned the fact that they can go into restaurants or trains or buses or whatever. That is what dogs are. Man's best friend, go with men everywhere. And there aren't better animals to work with people than dogs. And dogs actually absolutely enjoy it. It's really, if you look at those working dogs, I have to say that those working dogs enjoy life much more than 90% of the dogs I see in my clinic every day of the week underneath here. Because these dogs are working, are functional, are interacting, and are challenged by the situation rather than half pouch potatoes on a couch sitting there and not doing enough. Right? So I think this is something to keep in mind. Dogs enjoy those challenges and it's really fun for them. In what way dogs help autistic people? And I've listed here 4 things. This is not things I practically do. I think Yariv is the person to answer that. Maggie is the person to answer that. Linda is probably from a scientific point of view, and probably Kevin from its absolute practical point of view. But these are the sort of things that the dogs do for the people, for autistic people. They're calming the person. And I think Kevin identified that earlier on in his presentation. They're reducing the repetitive motion that people get, autistic people and people in, for this matter, some people that are not autistic. Normal people get into some stresses and get into those sort of issues that dogs can be an absolute help. Keeping the child from wandering off and being a soulmate, which provide a social, emotional contact and a relationship and a bond. I think unrelated to autism or any other disorder, in Japan today there are shops that actually rent you a dog or a cat for the night. And people working so hard in offices go down there and take a dog for the night or for the weekend because they can pet it, they can talk to him, and it is absolutely proof that petting is a great help. I don't necessarily support it. I think it's, from the dog's point of view, there is another issue. But I just wanted to highlight how far society can go sometime and unbalance that positive and could start getting into negative. What are some breeds of dog better than others? This is the question that you often ask. People often ask, especially if you don't understand enough about it. And really, in general terms, the answer is no. And again, Yariv will be the best person to answer those questions. But from the dog point of view, from my perspective, the question of breed is not so much an issue. The issue is the individual dog. And some lines of dogs, some families have higher tendency for certain traits and certain performances. But by and large, it's not a breed. And what's more important, the individual dog capacity to orient with people, to forgive, and be accommodating, to be bond easily, and to really enjoy and be active and enjoy life. You need that zest of excitement from the dog. And I think, again, we got quite a bit of an example from Kevin on that sort of aspect. But that's the most important things, rather than the individual dog. I know that they say that for blind people you need that side of a dog, and for hearing you need that side. I really think that it's more important the character of the dog rather than the breed of the dog. Training services. Training service dogs, it's really an art. Or you could almost, soon you'll be calling it science. The more scientific work we will do about that training of dogs, the more we follow what's happened, the more we see how it is, it will turn into science. Behavioral medicine a few years ago was nothing. Nowadays it's becoming an important scientific discipline. So I think it will be a science very shortly. It is relatively new, and there's quite a few organizations around the world and different people training in different ways. So you're going to find different ways, people doing different things. What's important, if you are searching this way, you actually try and find out what the outcomes. So don't just listen to what people do and how they train, but rather what the outcome. Give me some track record. Show me some dogs, show me some families, show me some process and progress that has been done. Most trainers, however, from my going through literature, prefer to train puppies for autistic people. Puppies give you the longest possible time to be bonded with a patient or autistic child. Puppies are the easiest to train from adapting and changing. And you really, as you'll hear from Yariv, training the dog and the person together. You're working with the family and the dog together. And that's why most time puppies are used rather than adults. Although in America there are some groups of people who train dogs and give you a 2-year-old dog for that family, and I think it's a lot of problems and poor success rate in that approach. You need to know that those dogs, once bonded to one family, cannot go to another family. So one dog that's not working in one family cannot go to another dog. It will be an absolute devastation for that dog to do that. So from the dog point of view, remember I'm the four-legged with the tail here. From the dog point of view, it is a bonding that needs to stay like this. And if it's not working, well, there's no more bonding. But you can't move it to another person and try and adjust him to the other person's idiosyncrasies and behaviors. So that's given in a general concept. I think dogs for autism or for any other disabilities have got those points of importance for us to do. We need to look at some of the dog's basic requirements, and we need to address them if we are to take a dog and look after it. There's a housing issue, there's a nutritional care issue, there's a health and well-being issue, there's grooming and coat care, there is exercise and socialization, and there is definitely environmental stimulation and enrichment, and that's applied to every dog, but certainly applied to people who take on with autistic patients. I think when we think of dog care, and I'm not going to go and talk about every one of them because every one of them is in our lecture, so we won't do that now. Just you need to be cognizant of it. When we do talk about dog care, we need to deliver something. And the delivery of dog care services, it is essential to follow an effective protocol. We need to know where we want to go from here, how we're going to go to there, and where we're going to finish there. We can't just take a dog to do those things and meander through the responsibilities and accountabilities that we need to have. And so each one of those programs depend on the individual dog, depend on the child or the person that needs it, depend on the family and the house where it is being delivered. So there will be some variation and changes that need to be set for each one. In Australia nowadays, certainly in Melbourne, Victoria, there are some laws around the countryside that require us to do certain things with any dog. Some extensions are being given to dogs of service dog, but generally there is law. There's a Dog Act, which is a Domestic Animal Act. There is POCTA, Prevention of Cruelty to Animal, and there are some certain things and codes of practices that we need to follow. Anyone who has a dog needs to follow, and those things apply equally to in principle, to autistic dogs who are working with assistant dogs. There are any of the protocol, any of the plans that we do. Protocol is really a plan, how we're going to do it, how we're going to care for it. It's got to be formalized, it's got to be clear what we want to do, and there's got to be a responsibility and accountability on whatever happens. Because ultimately, last point down there, the welfare of the therapy dog must not be compromised, because if the welfare of the dog compromised, the outcome, the welfare of the child is compromised, and the outcome of the program is compromised. So I think that goes hand in hand. Now what I thought, and maybe I don't have to do it, what I thought is to quickly mention some items that people tell me why they don't want a dog. They don't want a dog in the generally, or certainly people who need a dog from a therapy point of view. They identified me some 8, 9 myths, misconceptions, negative aspects of dog ownership and why we shouldn't own a dog. And every one of them is nonsense. So, one of the things is parasite can pass on from animals to men and cause disease in humans. Absolutely, that's true. But that's why we introduced worming programs. We tentatively worm a dog at the right time, every time as required. That's part of our program. And then there is no more issue and no more concern. Well, obviously we wash hands when necessary, and we maintain a normal hygiene. A myth. Time-consuming commitment every day to go for a walk, to exercise, to do things, it's chores, it's hard work. Well, actually walking the dog every day in the park is a tremendous therapeutic role for any person at any time. But this is really an authentic comment. Misconception, grooming and culture commitment. Takes long time, a lot of hair. Actually, another point, there is a lot of dirt in the house because the dogs have hair. Well, that's again, if we do it carefully, we do it daily, or every second day, we wash, we groom, we care for the dog in a normal way, then we care for ourselves. We get up in the morning and we come, we do whatever we do. We do the sort of things into the dog, then that issue becomes nonsense. And it is really false to think that that is a negative point for owning a dog. Soiling in the house and the surrounding, that's again the same sort of a thing. I mean, what do you expect the dog to sit there and have it there all the time, or only be ready to go when you weren't at home the whole day and you didn't provide place to go, or what else you will do? But if we provide the place, and I think again you can see a little really a nonsense reason. Licking people is said to be unhygienic, and I think Yariv will tell you how healthy it is in developing bonding actually. So licking is not unhygienic. No one gets sick from a dog licking him. We get sick from somewhere else from the dog, but not from the saliva. Pretty sterile. We don't even get, despite what your doctors might tell you, we don't even get tetanus when the dog bites us or a cat bites us, because they don't carry tetanus in the teeth. We get tetanus from something else. So really, saliva, yes, it might not look nice, it may be a bit smelly, especially if it's got bad teeth, but it is not a cause of disease in people. And some people like it actually. Obviously expensive upkeeping, health and food care, that's obviously an issue. That's another person in the family, another mouth to be fed, but I think the benefit that comes out of it are tremendous. There are pet insurances. Feeding dogs actually can be quite economical if we don't overfeed. And overfeeding is a major problem in service dogs. So you overfeed the dog, it gets overweight, and it gets into a lot of problem, and it almost gets like a pet. So feeding the right amount, the right food, at the right time is an absolute paramount that needs to be maintained all the time. And there are plenty of top food in the country. Heal Science Diet is one of those top nutrition in the world, which we here recommend strongly and push. And Heal's actually have supported the program in the past with us helping the program. Behavioral problems, well yes, dogs have behavioral problems. Behavioral problem, I usually have a behavioral person on the other side of that stick. And so behavioral problem in dog, majority of them are resolved if you train the dog properly and you train the person to do and follow what we are doing. Most people, that's unrelated to the autism issue, but most people, even when they're being trained, a few months, a few weeks, a few months, they forget. And so suddenly they go back to the bad old habit. So we need to go refreshing them. And again, Yariv is the absolutely right person to explain that. We run, from a clinic point of view, we run training courses, we run puppy schools, run a whole kind of activities to try and introduce behavioral and good citizen concept in dogs. And there are other courses all around Victoria, but it's not a real problem, it's a perceived problem. We need to work on it. If you want a dog, we need to do things, we need to be responsible and accountable for it. And I think that, and in the home, I think we've addressed already, so we leave it alone. These are the major myths that are being mentioned to me. I think in conclusion, the benefit of assisted animal therapy far outweigh a few negative and misconceptions that I identified for you before. The use of the dog or a pup with an autistic person need to be well planned and supervised, underpinned with effective management and care for the welfare and well-being of the dog. Well-being is the new term we are using with animal welfare because it's more than welfare, well-being. Yes, there is a cost factor, and we obviously need to take that into account in whatever we do, but that's everything in life has a certain cost. The value of using dog, puppy for an autistic person is unmeasurable in monetary terms. And I think the benefit to the family, as clearly identified by Kevin, excellent presentation by the way, is second to none, and for both the human and the animal involved. And I think with that, I shall say thank you.
Thank you very much.